Good afternoon. I think we would like to resume our schedule. I am David Davis. I am one of the infamous economists on the committee. I have the honor of introducing the closing act. I think the headliner always comes last.
Sure it does.
But the way we are going to proceed from here is we have a panel of vendors, and we're going to give them a time to speak, and we'll go for about an hour or so. We'll take another break, and then we're going to close with kind of a crosstalk between the vendor panel and the WIC director panel, and that will be the rest of the afternoon. I would like to welcome our panelists for our almost last session of the afternoon. I'm going to introduce them, and I'm going to go using the list that I have in front of me and not the order they are on the stage. I would like to welcome Cary Frye. She joins us from the International Dairy Foods Association. She is the Vice President of Regulatory and Scientific Affairs for the International Dairy Foods Association, a Washington, D.C. based trade association that represents the nation's dairy manufacturing and marketing industries and their suppliers, with a membership of 550 companies with a $125 billion a year industry. Ms. Frye is responsible for overseeing IDFA scientific and regulatory activities and representing member companies on key issues. Tammy Seitel joins us from General Mills. Ms. Seitel has worked for General Mills for over 20 years after receiving her MBA from the University of Minnesota. Her first 10 years were spent managing various brands, including Honey Nut Cheerios, Yoplait, and Betty Crocker Heritage Desserts. In 2004, Ms. Seitel assumed responsibility for health and WIC for Big G cereals. She led the initiative to improve the whole grain content of Big G cereals, which resulted in the reformulation of over 30 cereals to ensure that each and every cereal provided at least 8 milligrams of whole grain per serving. Today, General Mills has WIC-eligible products in 4 WIC categories, including breakfast cereals, yogurt, fruits and vegetables, and canned beans. Clyde Steele joins us to represent Mom's Fresh Foods, which is a WIC-only vendor located in California. Clyde was the vendor manager for the California WIC program from 2009 through 2013. He currently provides consulting services to WIC vendors in California, New York, and Oklahoma. Jeff Stilchenbauer joins us from the Kroger Company. Jeff has worked in the retail grocery industry for more than 27 years. Currently, he is the Corporate Government Benefits and Payments Manager. One of his primary focus areas is managing the WIC program for the Kroger Company. With this role, he manages the accuracy of the approved foods list for over 2,500 stores across the country, including 31 states and the various tribal agencies within each of those states. He works with each of the 19 Kroger divisions to ensure they are following proper procedures. Though new to this role, Jeff's experience within the Kroger organization provides him with exceptional knowledge and insight into the food industry and how that can provide the best possible product and experience for WIC families. Okay, each representative is going to share their perspectives for approximately 10 minutes or so, to be followed by an open discussion with the committee. With that, I'm going to invite Ms. Frye to begin.
A wire. Well, good afternoon. It's a pleasure to be here with you today. As you heard, International Dairy Foods Association is a trade association whose members process, market, and distribute approximately 85% of fluid milk, yogurt, cheese, and ice cream products nationwide. The nearly 200 companies that I represent are proud to provide nutritious milk, cheese, and yogurt products that are offered as part of the special supplemental nutrition program for women, infants, and children. Dairy foods are nutrient-rich, affordable, and offer a unique set of essential nutrients. The 2015 Dietary Guidelines for Americans confirm that dairy foods are critical as part of a healthy diet. The Dietary Guidelines Advisory Committee identified 4 essential nutrients which Americans fail to consume enough of. 3 of these nutrients, potassium, vitamin D, and calcium, are found in dairy foods. As you heard this morning, the Dietary Guidelines report showed you that current intakes of dairy foods for most Americans are far below recommendations of the 3 daily servings, and they call for a shift to consume more dairy products. It's startling to see that almost 90% of the population doesn't consume the recommended amount of milk and dairy products, which are underconsumed at almost the same alarming rate as vegetables. U.S. milk consumption has steadily declined over the past 4 decades and is being surpassed by sugary drinks and bottled water. While some consumers have transitioned from drinking whole milk to lower-fat versions, there hasn't been the corresponding increase in the consumption of low-fat and non-fat varieties. As you can see from this slide, in 2013, which is the most current data we have from USDA, whole milk and reduced fat milk, or 2%, represent almost 2/3 of the consumption, while low-fat, 1% milk, and fat-free only account for 31% of fluid milk consumption. Oops, sorry, not quite there yet, but go back. No? Okay, we'll just keep going. As you know, the 2015 final rule revising WIC food package required a change in milk types so that the option to choose reduced fat milk that contains 2% fat was no longer available for children over the age of 2 years and women unless authorized by medical care provider. Since October 1, 2014, the milk options for these participants is only low fat with 1% fat and non-fat milk. IDFA is concerned that limiting the WIC participants to milk choices that are preferred by only 1/3 of the population can lower redemption and consumption of fluid milk and cause children and women to lose critical nutrients that milk can provide. Unfortunately, as the committee is aware, it's difficult to find data on intake and redemption levels by milk and fat type for WIC participants since the issuance of the final rule. However, for now, we can look at this EBT data from Texas. This was captured in a snapshot that can look at the data reported on milk sales from WIC participants. Texas is one of the most culturally and racially diverse states, and its population of over 25 million makes it the 2nd largest state in the country. This slide shows a continual decline in milk sales in Texas over the past few years, which is greater than the decline in the total number of WIC participants. In fiscal year 2015, the percentage decrease in WIC total sales in the dark blue was more than 4 times greater the decline in the WIC participants. During the first 4 months of the fiscal year, where we had data in fiscal year 2016, milk sales continued to drop. The light blue bar includes analysis of lower fat products. This is a combination of reduced fat that was available in 2015 early, and then the change to just the blue bar in 2015 would just be the low fat and non-fat. So it's excluding the whole milk when you look at the light blue bar. And when we compare this, you can see the lower fat milks fell 17% from 16.2 gallons to 13.4 gallons. This state's data demonstrates the strong correlation between eliminating 2% milk from most food packages and the sharp drop in milk consumption. As states continue to move to electronic WIC transaction, we hope that more data will be available on whether fluid milk redemption rates are continuing to decline, or in fact they might recover. I would also like to note the pending Child Nutrition Authorization Bill in the Senate right now includes requesting the USDA that the WIC milk redemption trends as they relate, I'm sorry, I'll go back and go over that so you can hear it correctly. Request that USDA review the milk redemption trends as they relate to the current dietary guidelines. So looking in more depth at milk redemption is a requirement that right now is in the Senate's version of the Child Nutrition Reauthorization Bill. In looking at the different types of milk that are available in the market, it's important to note that all varieties provide essential nutrients like calcium, potassium, vitamin D, and protein. And the difference between 1% milk and 2% milk is just 20 calories and only 2 more grams of saturated fat per cup. The committee's Phase 1 report noted some emerging data suggests that dairy fat consumption may have different implications for health than other types of saturated fat. This topic was not covered in the 2015 Dietary Guidelines Advisory Report, as the data was just being published at the end of the DCHE deliberations. However, as you're well aware, the Phase 1 report did highlight a recent review of 16 studies that found no positive association between the intake of higher fat dairy foods with adiposity at baseline over time. In fact, a growing body of evidence links dairy foods with multiple health benefits. The National Dairy Council identified studies published between 2009 and 2015 after the deliberation of the Dietary Guidelines Advisory Committee. And this slide continues to show the many high-quality studies finding evidence that connects dairy foods with lowered risk of cardiovascular disease, blood pressure, and type 2 diabetes. Because dairy foods provide many shortfall nutrients and are associated with the lower risk of chronic disease, nutrient-rich whole and reduced fat milk, cheese, and yogurt should not be the foods to focus on when encouraging people to consume less saturated fat in their diets. Allowing flexibility for consumers to choose low-fat or fat-free options, as well as whole and reduced fat varieties in a calorie-balanced dietary pattern should fit within the 2015 Dietary Guideline recommendation, as long as the saturated fat limits are not exceeded. While the milk and dairy industry supports WIC's nutrition education program in encouraging participants to choose 1% and non-fat milk, these efforts should be broadcast in tandem with a stronger message to drink all milk offered in the package. In summary, milk and dairy is an underconsumed food group for most Americans according to the 2015 Dietary Guidelines. IDFA supports the inclusion of a variety of dairy products in the WIC food package, including fluid milk, lactose-reduced fluid milk as well, yogurt, and cheese to allow WIC participants to select the dairy products they prefer and will consume. USDA should review the WIC milk redemption trends with regard to milk fat types. It's critical for the committee to consider allowing milk choices that reflect the WIC participants' and consumers' preferences. It would be easier for participants to request, it should be easier for participants to request 2% milk. And IDFA recommends that WIC participants should be able to receive reduced fat milk as an option for themselves and their children over 2 years of age. Allowing flexibility to choose reduced fat milk could fit within the 2015 dietary guidelines when saturated fat limits are considered. IDFA and the dairy manufacturers I represent believe that flexibility in dairy product choices and continued educational efforts will go a long way towards helping children and mothers get the nutrition they need for a healthy future. Thank you.